One of the other more common visits that we get to see are recurrent bladder infections. And recurring bladder infections can be of different types and etiologies. For example, some people, their recurring bladder infections occur when they have a new partner, maybe haven't been having intimacy in a while, and they're getting trauma to the urethra, and every time they have intimacy, they get a bladder infection to follow that, which some people used to call honeymoon cystitis. That is treated typically medically, and usually fairly easy for us to correct. So we treat the infection that you do have, and we talk about maybe using a low-dose antibiotic or different methods of keeping the urethra clean or less traumatized to help prevent those infections from happening. And often with time, they will go away on their own, but we can speed up that process. Other times, there's an infection where you had a bad infection for whatever reason, bad luck, or some events that may predispose you to infection. And I have a list, but hot tubs, thongs, tight jeans, intimacy, ride a bike, ride a horse, long car ride, long plane ride. So somewhere where you're sitting and you maybe get a little irritated from sitting for a while, or hang out in a wet bathing suit. And we see these a lot in the early spring as people move back outside and start getting active. And we actually see a lot in the early winter when people start wearing heavier clothes and go inside and they're wearing the heavy clothes and they get hot and irritated. So for those people, they get a bad infection and they get treated. And then a week or two later, they get another infection. And then they get treated. And then a week or two later, they have another infection. And often that's just that the first infection was so bad that the bladder hasn't restored its normal defensive mechanisms. And they're getting recurrent infections because the bacteria can just come right back in. And so sometimes we will give a low-dose antibiotic for a short period of time, 1 month up to 6 months, to sort of let the bladder heal and recover, and then stop that and the infection stay away. If the infection continue to happen, we will look to make sure there's nothing bigger going on. Is there something like a lesion in the bladder, or a bladder cancer, or kidney stones, or bladder doesn't empty well or doesn't function well? So we can do a bigger workup to make sure that there's nothing anatomically wrong or physiologically wrong with the bladder, the kidneys, etc. We also might screen for some medical diseases, such as diabetes. So diabetes may predispose you to urinary tract infections, or if you have diabetes and you're not controlling it well, it may predispose you to urinary tract infections. So we may talk to you about how do we make your sugars a little better? How do we tighten them up a little bit to help control that? But the good news is most of the time, this is actually a fairly easy visit for us as physicians because we can usually make you better, which makes us happy.